All right. So Dr. Cho, Grace, Jay, we ready to go? Yep. Okay. So so let's get started here. Just again, thank you so much for joining us. My name is Dan from Lifestyles Medicine, and we really thank you for joining, sharing your Saturday evening with us. Just before we get started, I just want to mention a few things. First, that this session is being recorded, so please do take note of that. Also, we will be sharing some health information. Please note that this session is only for educational purposes only. Please speak with your healthcare provider before implementing any of this information. Uh, I want to just say a few words about our partners for this event. So again, my name is Daniel from Lifestyles Medicine Institute. And basically we're a not-for-profit based in Toronto where our mission is to train every Adventist in lifestyle medicine. So we could practice the health message, but also share it as well. So we have some training programs. And if you want to learn more about us, go to www.liminstitute.org. There's also a website, and feel free to text us at that number there.
Andrew coming here?
We also want to recognize Lifestyles Medicine. Lifestyles Medicine is a not-for-profit of Seventh-day Adventist health professionals who their mission is to help people prevent and reverse chronic diseases using science-based lifestyle medicine community programs. So they partner with churches to put on various health programs. So if you want to check them out, go to lifestylemed.org. The URL is there on the screen. We also put these on the chat box. Our clinic partner is Pathways Lifestyle Medicine Clinics. It's naturopathic clinics that focus on preventing, treating, and reversing diseases using evidence-based lifestyle medicine and natural therapies. They have 3 locations in Toronto, and so if you want to check them out, book an appointment, there's the URL there, and the email and the telephone number. Oops. And finally, we are proud to partner with Paradise Fields. Paradise Fields is an Adventist-owned certified organic farm in the Hamilton area and a clinic as well. And their mission is to heal by producing the world's most nutrient-dense produce. It's a beautiful place. You should check it out. Go to paradisefields.ca. So I want to thank our partners for working with us on this session. So our session today is called What If I Don't Get It? And it's sort of a follow-up to a webinar we did just I think 2 weeks ago about the COVID vaccine, where we had 2 doctors share the actual published study in the New England Journal of Medicine on the Pfizer COVID vaccine. We are doing it, the first one was done mainly for an Adventist audience, but we're doing it again for a more general audience tomorrow at 2 p.m. So if you're interested and missed that other session, you could register still. Just go to lifestylemed.org/online and you could listen to the presentation. But today, what we really want to do is we want to kind of look at the wider implications of COVID-19 vaccination and public health measures. So my guess is that many of us here, some of us might plan to get the vaccine, some of us might be hesitant. And I think many of us, we have, questions about what happens if we don't get it. Will we be healthy? Can we still be healthy? Will we be able to travel, run businesses? How about the kids? Can they go to school? How about churches, events, other ministries? We've heard from governments that if people don't get the vaccine, there may be some consequences. And I think people are asking these questions. So that's what we really want to explore today. What we really want to focus on is more of the religious liberty implications. So, due to the pandemic, we've seen governments, shut down businesses, travel, schools, even churches for that short time over there in the spring. They mandated masks. And I know Adventists who've run into problems with their business because some of their employees couldn't wear masks and this sort of thing. So I think many Adventists, and probably some of us here, and that's why you've joined us today, have questions about, can governments really do this? How about the churches? How about our freedoms? What is the balance between public health and our freedoms? And I think as Adventists, given our unique message and our eschatology, we have a keen interest in both health and religious freedom. So I think these questions should be of importance and interest to all of us. So we want to shed some light on those today. So I hope that we can do that. So just very briefly, I want to introduce you to our speakers. So first, Dr. George Cho is a naturopathic doctor and clinic director at Pathways Lifestyle Medicine Clinics. He specializes in the prevention, treatment, and reversal of chronic diseases using science-based lifestyle medicine. He also works at the Cleveland Clinic Executive Health Program. So thank you, Dr. Cho, for joining us. We're also joined by Jay Cameron. He's the litigation manager at the Justice Center for Constitutional Freedoms. Jay has appeared at basically every level of court in Alberta, British Columbia, Nova Scotia, and he believes in the importance of constitutionalism, is an expert in our rights to religious liberty, and so he'll be answering some of those questions for us today. So thank you, Jay. And Grace McIntosh is a lawyer and a legal counsel for the Seventh-day Adventist Church in Canada. I'm sure many of us know her. She represents and advises our church on legal matters. So Grace will be speaking to us primarily about the implications for Adventists in our ministry, our religious freedoms. What can we do if we believe that some of our liberties are being restricted, or we're concerned about that? So I want to thank Dr. Cho, Jay, and Grace for joining us. So what we're going to do today is first, we spend the maybe first 30 to 40 minutes with some questions that we prepared, some of the questions also that you've submitted when you registered. Then in the last around 20 minutes or so, we want to take your audience questions. So we encourage you, as you listen to what's being shared, if you have a question, please put them in the chat box and we'll try to get to as many as possible. And also if you have just comments, please share those as well. We would love to see your input on the topics that we're discussing. We know that some of these things might be sensitive, but we want to have a conversation, and that's why we're here. We just ask that the questions and the comments be kind of related to the discussion that we have today. Okay, so let's first start with Dr. Cho. So Dr. Cho, I think regardless of whether the vaccines are safe or not, I think many Adventists are hesitant, and so I just want to ask you to start this off. If people don't get the vaccine, can they still stay healthy? Because I think people are concerned about that. They don't want to get the vaccine, but will they still be healthy? What can they do in terms of their health?
All right. So Daniel, if you could let me share my screen. I'd like to share some slides here to help answer that question. All right, everyone. So what if I don't get the vaccine? What can I do? What does that mean for my health? So very quickly, in order to answer that question, we have to really understand what the vaccine has been shown to do, okay? And for a more in-depth discussion on this, I refer you to our webinar that we did 2 weeks ago on the Pfizer vaccine. But just very quickly, so in the Pfizer study, what they found was that after the second dose, there was a significant difference between the vaccine group and the non-vaccinated group when it came to cases of COVID-19, symptomatic case of COVID-19. So 8 people in the vaccine group got symptomatic COVID, whereas 162 in the non-vaccine group got symptomatic COVID. So you can see here is a big difference. It's a 95% efficacy. I want to point out that it is a small fraction of the total study group, so 18,000, approximately 19,000 each group. So it's a very small portion of the total study group. Nevertheless, when they looked at actual manifested cases, symptomatic cases, the difference is definitely quite striking. When it came to severe COVID, it was about 1 versus 9 when it came to severe COVID. So in here, this refers to just you got symptoms. It doesn't matter how severe it is. Here is talk about actually, you had difficulty breathing, you need to go to ICU, hospitalized, and that type of thing. So as you can see, it's about 1 versus 9. So again, a small fraction of the total group. Nevertheless, it's undeniable that there is a difference, okay? When it came to deaths in the Pfizer study, both groups saw no deaths from in the vaccine group or in the non-vaccinated group, okay? Now, some might argue that, if the study went on longer, that, there would be more deaths in the non-vaccinated group, and that's definitely plausible, but just the study didn't show any deaths, okay? And the Moderna study showed very similar results. So basically, there are a few things that can happen with COVID-19. So you can get infected, you can transmit the virus if you get infected, you can get ill, severely ill, and you can die. What I think that the studies show from Pfizer and from Moderna is that there is some level of efficacy with reducing the risk of severe and symptomatic COVID-19, okay? So the studies do not tell us much about getting infected or transmitting the virus. Okay, that's very important to understand when we talk about the implications of not getting the vaccine, okay? And the amount of lives that it would save, so the number of deaths, that's still kind of up in the air, okay? So what do we do? What do we know then about those who have, about not getting the vaccine? Well, if you look at the total cases of COVID-19 in Canada, the breakdown looks something like this. The vast majority of people from July and in December are recovering from COVID-19. Okay, so you see that? And only a very small fraction are actually dying. Okay, so more than 80%, close to 90% of Canadians who've gotten the disease actually fully recovered. A very small fraction actually died. And this is without the vaccine, right? No vaccine, okay? The problem is that we don't know which one we are, right? So are we in this group or are we in this group, right? It's kind of like smoking. So the majority of people that smoke, they don't get lung cancer, but there is a chance that you might get it, and we just don't know which one we are, right? So it's similar to COVID-19. The risk of you recovering is very high, but also there is the risk that you might die and get severe COVID. So we don't know which one we are. But there are some, we know based on kind of the evidence that's coming out, who is at higher risk, all right? So this is a study that came out in the Lancet, and they project that 1 per 900 young people, less than 20-year-olds, would need to be hospitalized if they got COVID-19. So that's a very small fraction. So if you're young, the risk of you needing to be hospitalized from COVID is very, very small. However, that fraction goes up as you get older. Okay, so definitely if you're elderly, your risk of severe COVID definitely goes up a lot, all right? We also know that if you have chronic diseases, your risk of severe COVID increases quite dramatically as well. So heart disease, hypertension, obesity, type 2 diabetes, those types of things. So if you have a chronic disease, then you are at elevated risk of severe COVID. Okay, that's undeniable, all right? And so that is something that you need to be aware of. Okay, so for example, in this study out of New York, they showed that a significant majority of those who were hospitalized with COVID-19 were either obese or morbidly obese. So you see that here, more than 60% of people who are hospitalized were actually in the obese category. Okay, so these chronic diseases is a risk factor for severe COVID. Okay, so I think, Daniel, what we can say is that if people do not get vaccinated, actually, in fact, either case, if you have a chronic disease, you are definitely at risk for severe COVID-19 outcomes, particularly if you are elderly as well. Okay, so what that means then is that as admins, we have a health message, and basically, if you decide that you are not going to get the vaccine, okay, and that is your choice to make, then you really need to start following the health message very, very seriously, because you need your immune system to be in tip-top shape. Okay, so following a healthy plant-based diet, exercising, sleep, and natural therapies, natural like remedies like hydrotherapy as well can help boost the immune system or optimize the immune system. So exercising, eating really, really healthy, a plant-based eating pattern, these things help um, limit or lower the risk of chronic diseases that increase the risk for severe COVID. These also, if you already have type 2 diabetes, obesity, heart disease, and these things, then following these healthy lifestyle practices can actually help potentially even reverse these conditions. So if you're here in this webinar and you decide not to get the vaccine, then it's really important that you start really taking care of your health and making sure that your immune system is at an optimal level by practicing healthy lifestyle behaviors.
How about for children? We got several questions about children getting the vaccine. Is the vaccine effective for kids? And if they don't get it, what should be some concerns?
Well, right now we know that
considerations.
Young children are actually not at a great risk for severe COVID. All right, so the risk of them needing to go to ICU or having advanced case of COVID is actually very, very low. Anyways, the vaccine is not even approved for children right now anyways. So your children cannot even get the Pfizer or the Moderna vaccine. So that's not even a concern at this time, right? So, but you should still make sure that your kids are also healthy as well. But even just among kids in general, the risk of severe COVID is very, very low. It's the elderly with chronic diseases. Really, that's kind of the population that is at greatest risk.
Okay, awesome. Thank you, Dr. Cho. And if you have more questions related to the health implications, please do put them in the chat box, and we'll try to get to them after the main discussion. So Jay, I want to kind of turn to you now, and let's talk about some of the constitutional religious liberty questions here. So first thing, as I mentioned in the intro, and as we all know, we've seen over the past year, governments the world over have done things that we've never seen before. They shut down travel, ordered businesses to close, schools, churches, told us that we can't see our families, and a whole host of other things. And maybe can you help us understand, like, are these, is it right for the government to do this? Can the government do this? Is it constitutional? Can you help us understand those questions to start off?
Sure. So I think that there's a few answers to this that bear thinking about. The first is that this occurred with unprecedented speed. It's the whole thing is unprecedented, but it's occurred with just incredible rapidity. And so in the wake of the decision of governments to shut society down, you had something very significant happen, which has never happened before, and that was that courts also ordered themselves shut down. And so that has delayed testing a lot of what has happened. And when Canadians needed courts the most, the courts were gone. And that's very unfortunate, because there have been just extraordinary infringements of constitutional rights across the country, very pervasive, as we all know. So I'd like to look at the question this way. The Charter guarantees fundamental rights and freedoms, but there is a qualifier in Section 1 of the Charter, and that qualifier is that governments, if they can justify an infringement according to law, as in a free and democratic society, then the law may be justified. And so one of the things that we're focusing on in the challenges is the fact that you have unilateral lawmaking abilities that's been bestowed on public health officials and on ministers of health. And so what has happened is that there's a bypassing of the legislature, and you have rule by very few, or by one individual on behalf of millions. And again, this is unprecedented in Canadian history. there are clauses, legal clauses called Henry VIII clauses, which are very controversial. And at various points in time in Canada, these laws have been used to transfer legislative power from Parliament or the legislature to cabinet, which is the executive. There are three branches of government. You have the judiciary, you have the executive, and you have the legislature. And so the transference of power to the executive to make lawmaking power is what resulted in the internment of Japanese Canadians during World War II. And so it's very controversial. And the reason it's controversial is because you're bypassing the elected representatives of the people. And so, you know, it really is an overthrowing of democracy to a significant extent. And then when you give that power to make laws of broad general application to individuals, you're even further circumventing democratic imperatives and norms. You have medical officers of health who are not elected. They are not democratically accountable to the electorate. They can't be removed by people at an election. And they are not accountable to the legislature in an observable fashion. They have this enormous unilateral power. And so the question about whether or not a lot of what can take place, we're just really getting rolling on it. There are challenges that have been launched in various places, and shortly here we're going to get before courts and we're going to have answers to these things. I can tell you that there are clearly lines in the sand which the government is not willing to go beyond. For example, the government was refusing to process passports for part of the time unless you could demonstrate urgency. And you know, if you didn't have a passport, you couldn't leave the country. You couldn't enter the country. So if you were outside the country and your passport expired, you were stranded outside of the country. And the government was saying, well, you know, if you can't demonstrate, you know, sufficient urgency, then you can't come back in or you can't leave. And when they were sued over that, they immediately backed off and started processing passports again because they didn't want to run that argument in a court of law. They just didn't feel like it was a big winning argument. And so there are other lines in the sand that we are starting to see develop as well. For example, long-term care homes telling family members they can't come in. A lawsuit was launched in Ontario over that. And, you know, it was not very long before the government said, all right, they leaned on the care homes and the care homes complied and, you know, visits began again. But until you get the government on some of this stuff into court, it's very difficult to establish a line. The other thing that has yet to be tested is the weight of some of these measures against the charter rights of Canadians. And that's going to be a complex analysis that's going to deal with expert reports. And it's going to involve questions that the public knows the answers to already, and the courts will soon know the answers to. And that's things like the fact that deaths in Canada are not extraordinarily high for 2020. In fact, it's been an average year for deaths. And this is reflected in the provinces across the country. There was a spike in deaths, but those were people, it appears, who would have died later in the year. They died earlier in the year. And the total aggregate for the year is approximately within the norm. It is within the norm of deaths for a given province, and then nationally as well. You can see that chart. I posted a paper. It's the Justice Center's paper, Flying Blind. You can click on the link. It's in the chat there, and you can look at some of the data that we have compiled. Another issue is the reliability of PCR tests. And so you see a lot of hysteria in the media about COVID-19. First, it was projections about death. You know, we know that those projections were inaccurate. Dr. Neil Ferguson has a long history of making inaccurate predictions. This is another one of them. And he's somebody who shouldn't be relied on to advise government regarding pandemics anymore. I don't know why they listen to him, but we know from looking at the data that the deaths that were projected didn't materialize, even with the reporting of cases on a very high level attributed to COVID that maybe were from other causes. The deaths did not materialize. And so that has yet to be tested. And then the accuracy of the PCR test has not been tested in a court of law, and it's going to be. the polymerase chain reaction test, which is the supposed standard for determining if somebody has COVID-19, is known to be inaccurate and unreliable, result in a high number of false positives depending on the cycle threshold that is used. And so all of these factors are going to go into whether or not the government is justified, whether or not it's legal, it's constitutional what they've done. That's a long answer to your question, but that's the answer for me.
So, Jay, can you share with us who is Neil Ferguson, just for our audience?
Yeah, so he's a fellow from the UK who is he's a scientist, and he has a history of making these projections with respect to the death tallies. And so he projected that there would be 1 million deaths in the United States and that there would be 500,000 deaths in the UK. And he very emphatically said that everybody should be locked down. At the same time that he was demanding that society be locked down, he was in his flat sleeping with a woman who was not his wife, who then went back to her family, and he had COVID at the time and was aware that he had COVID, and so he passed that to her. She took it back to her family, and so he's been disgraced. But we see that in the latest rounds of lockdowns, Neil Ferguson is again advising the UK government, the Boris Johnson government. So,
okay, thank you. So let's turn our attention to vaccines. So I think many people are, many Adventists especially, are concerned about the vaccine, but also about the consequence of not getting it. Again, as I mentioned, here in Ontario, they said potentially people might have limitations on travel, on other sorts of things, can't go to certain places. So is it in terms of the Constitution and our liberty, is it right for the government to place restrictions based on vaccinations? Is that something the government can do or even should do?
Are you asking me?
Yes, Jay, yes.
Okay. We haven't faced broad mandatory or forced vaccination requirements in Canada before. There have been attempts. In some provinces, there are laws that are on the books. For example, in Alberta and Saskatchewan, and I believe in Manitoba, there are provisions which allow for the government to compel vaccination. And in Alberta, for example, those requirements either rest with cabinet or with the health officials, and they've never been used. And so can the populace be compelled to be vaccinated? Well, it hasn't happened yet. And the Supreme Court of Canada has said that you have a fundamental right under Section 7 of the Charter, which is the right that protects life, liberty, and security of the person, to make decisions for yourself with respect to medical treatment. It's a very strong right, and it extends to parents with respect to the medical decisions of their children. And now that is not to say that the right is without qualification, because in the cases regarding blood transfusions, for example, with Jehovah's Witnesses, we have seen courts override the decisions of parents with respect to giving children blood transfusions if their life is at jeopardy. And so that is case law that is out there. But the analysis with respect to vaccines is going to inevitably run into the area of into the question of, well, how serious is COVID-19? You have a 99.7% recovery rate, as George pointed out a moment ago. The vaccine is 95% effective or so, and there's no evidence with respect to transmissibility or infectivity, only with respect to severity. And so can the government compel you to take a vaccine where the disease is not as serious as was first feared, and where the vaccine is not shown to be efficacious to prevent infectivity or transmissibility? And then you start adding in the other problems with these vaccines, the fact that they have not been tested extensively, the fact that side effects are unknown, the fact that you have experimental technology in the vaccines with respect to the modification of RNA. These are all factors which go into a person's decision about whether or not they want the vaccine. And what we're seeing around the world is that many medical practitioners are saying, no, we don't want the vaccine. We don't want the vaccine because we've gone the last 10 months without it and we're fine. We either had it and now we have immunity to it, or we haven't had it and we're not concerned about it because we're healthy otherwise. And so, you compare that with the incident of people who are experiencing anaphylactic shock. That's a known side effect of this particular vaccine in some cases. There are people who are otherwise healthy who have been vaccinated and then they die. And at this point in time, there are a minority of cases. But all of this will go into the analysis about whether or not, if a government attempts to mandate or force vaccines, about whether or not that's constitutional. And I think the answer at this point in time, given the data that we have, is that the answer to that is likely no. It could go all the way to the Supreme Court of Canada. But I should also say that some governments have said they will not mandate vaccination for COVID-19. Yet the laws remain on the books. And so governments have a history of going back on their word, as we know.
Thank you, Jay. And Jay, how about employers? Can employers require their employees to get vaccines?
So different analysis with respect to employers, unless you work for the government. So your charter rights in Canada kick in when you have a conflict with the government, when there's some infringement from government. But if you work for a private entity, for example, if you work for Walmart or Costco or somebody like that, there's a different analysis which you have to go into. So you don't have constitutional rights against private employers in most circumstances. And the reason for that is because the charter does not apply to bind private employers. However, human rights legislation does bind private employers. And so if you are a person of conscience, you have a conscientious or religious objection to vaccination, then the compulsion to be vaccinated as a condition of employment would be an act of discrimination under the human rights laws. And so that's something that would have to be run in the human rights tribunals as well.
I see. Okay. So Jay, kind of like zooming out a little bit. So can you help us understand what is the balance between like public health and our constitutional rights and freedoms? Because, on one hand, if there's a disease that's going around, then, we should do something. But on the other hand, there's this kind of bedrock of our constitutional rights that really shouldn't be violated. And it's kind of like this juggling thing. And right now, I feel like the public health considerations are weighing stronger than the religious liberty or just constitutional rights in general. So what is sort of the balance between the two?
So one of the problems in Canada right now that sets Canada apart is the fact that Canada has socialized medicine. Government entity which employs tens of thousands of people and is sort of like this sacred cow, if you can forgive the expression, in Canada, that is guarded at all costs. And so the difference between Canada, for example, and the United States is that you have politicians still in power in the United States. You have doctors, in some cases hysterical doctors, saying everybody must lock down. We must lock down society, right? Everybody stay in your homes, right? Curfew, right? The sky is falling, but doctors aren't supposed to be running provinces. And the reason why we don't allow doctors to run provinces is because they don't know what they're talking about with respect to other issues. So for example, they have no qualifications and they have no ability to consider things like trade and commerce. They have no ability to weigh the social impacts of their decisions. And I don't think that some of them particularly care. They want to prevent transmission. But if you become an alcoholic and a drug addict and you become suicidal, as long as they are preserving beds in the hospital, and I'm just speaking bluntly here, as long as they protect beds in the hospitals, as long as they protect capacity, then they're quite happy with the results. But the legislature is supposed to consider the broader implications on behalf of society, and that analysis is supposed to extend to constitutional rights. You know, what are the implications for the rights of Canadians in a free and democratic society when doctors are compelling everybody to stay home and not go to church and not go to restaurants, and you can't have people over, you can't have Bible study in your house, you can't do any ministry, right? And it's all in the name of preventing transmission.
Mm-hmm.
So yes, the public health implications in Canada are out of whack. It's like a wagon with one wheel that's been inflated grotesquely, and you know, and it's off balance because of it. And Canada is off balance because of the disproportionate emphasis on public health as opposed to other factors, including the rights and freedoms of Canadians. You know, we could all live for the next 60 years locked in our houses and there would be no transmission, but that's not the presumption that society in Canada is based on.
Right. Thank you, Jay. And maybe briefly, just one final question for you. Why do you think that our rights and freedoms get such little attention right now during this pandemic? You know, we talk about everything else, it seems, except for our rights and freedoms. Why do you think that is? Like, has it been lost in the Canadian consciousness, and you know, writ large, or what do you think is going on there?
I think that the answer to that question is nuanced. First of all, I think that the media has driven hysteria on this, and they print stories about cases as opposed to people who are recovered, as opposed to people who have immunity, as opposed to the many good stories with respect to the pandemic. And you know, people have been locked in their houses and they're sitting in front of the television, and so, you know, they're constantly bombarded with this negativity from the media, and politicians and judges are not immune to that for obvious reasons.
Right.
They also are locked in the house in front of the television. And so that's part of the narrative. But part of the narrative is that Canadians are complacent. Canadians have had it good for so long, and had it so good for so long, that it is a shock to them that these rights and freedoms could be stripped away. And there's a quote from learned Hand, who is a justice in the United States. That's from a book called The Spirit of Liberty. And he said that basically, when liberty dies in the hearts of men and women, no constitution can save it. And so, you know, the idea of individual rights that Western society is founded on, the idea of give me liberty or give me death, the idea of you know, your right to make certain decisions with respect to your speech and your religion, your conscience. These rights are what built Western society. And you know, instead of talking much about liberty these days, you hear a lot about peace and safety. And peace and safety and equality are the most important things, not freedom. And you know, we know what the Bible says about when they say peace and safety, then sudden destruction comes. And so we're seeing the sudden destruction of rights and freedoms in Canada take place at a precipitous rate, and it's frightening. So I mean, the answer is you have to have the populace assert the fact that it is a free and democratic society. If you want this to be a free and democratic society, you have to assert that you are a free and democratic person. Take part in the public process, and not just that, but you have to be a free individual in your mind. If you bend the back to slavery, then you will be a slave very quickly.
Awesome. Thank you, Jay, so much. So I want to turn to Grace before we go to audience questions. So Grace, can you share with us, do you think that perhaps what we're seeing right now is maybe a glimpse of what we could see in the future when they try to, you know, say that we have to do certain things or force people to do certain things for the wider public good?
And can you hear me?
Yes.
Okay. Definitely precedents are being set. And I think that it bears saying that at the time of Christ, there was a pandemic or an epidemic, if you want to say, and it was leprosy. And in 21, which was the first Sunday law, there was also a plague, and it was referred to as the epidemic of Eusebius. And there's tossing around ideas that it might have been the smallpox, at that time. And we have the spirit of prophecy that reminds us that health is connected to the third angel's message. Not only that we need clear minds, and that's related to lifestyle and understanding how the body works and what causes disease, but that there are many people who are not going to be well, and that health and lifestyle is going to be the right arm of the gospel.
And Grace, for just two questions here. So for church members who want to continue doing ministry during these times, what would be your advice? And second one is for those who feel like who have concerns about their religious liberty, what recourse do they have? What can they do? So just two questions.
Yes, I will answer that. I'm just going to tack on something to what I said earlier, which was also in 1888, which was the Blair Bill was in front of the Education and Labor Committee in the United States. It was the Sunday law. And there was also about a 3-year pandemic that had started in that year. So it's very interesting to see typology or repetition of history. Now, in answer to your question, advice to people who are practitioners and so on, there's a very clear principle from the spirit of prophecy that says when the government infringes on rights so that the service or worship to God that is his right to receive is interfered with, you must you must stand on your principle and provide that worship to God. When it is a matter of your clear mind, which is imperative for worship, then you must stand on your principle. And if that's not the case, it is really important to fight for rights, but you would want to then go through all the processes that are provided by the law, in which is, Jay's a lawyer who has clients and they have, they're in the courts, or he's giving testimony at committees and hearings that are at the government level. And so for those who are practicing, we haven't lost our right to provide natural health methods. And so continue until there is a complaint, and maybe that complaint will go to a court of law, and then we'll have to follow this process. One of the things that's very interesting about the sequence related to end time events is that before the Sunday law comes, the courts interfere with, or they have a word to say with respect to discipline in the church. And that is happening, and it did happen historically in 314 AD, before the 321 Sunday law. After the Sunday law comes global government and the courts looking at or interfering or making decisions with respect to doctrine. And you see the spirit of prophecy says that we will be before the courts with respect to doctrine. And when we are before the courts, or we're in front of a committee or hearing at the government level, that is bringing the gospel and the right arm of the gospel if it involves health.
Okay, great, awesome. Thank you, Grace. So what we're gonna do now is turn to some audience questions. So I'm gonna, Dr. Cho and Jay, I'm gonna pin you as well. And we can try to get through some of these questions. So if there's a lot of questions coming in, so we'll go through them first come, first serve basis. And please keep putting them in, and hopefully we can get to them. So first question, I think it's for Grace or Jay. Is it true that vaccines will be mandatory for postal workers? Just very briefly.
I don't think that's been determined yet. I think that there's been rumblings about mandatory vaccinations, but I don't think it's been decided yet that there will be mandatory vaccines for postal workers. I certainly haven't heard that.
Mm-hmm. Okay.
It's being talked about in varieties of contexts, such as for healthcare workers and things like that, education, teachers, etc. But I don't think there's been anything concrete determined.
And I would be very surprised to see a mandate coming from the government, because the material coming from Moderna and Pfizer is that they don't know with respect to adverse effects. You know, they don't know that. In the United States, they have a $16 billion slush fund. Jay told me this. And that slush fund is made up of taxpayer money. And they have an act in the United States that's a vaccine act for individuals, families where their children have suffered adverse reactions to vaccines. And Canada has a program that Trudeau announced for adverse reactions, where people can, register and they can access the government directly with respect to adverse reactions to the vaccines. And if the companies, don't have, if the companies have set out in their own literature that they do not know what adverse reactions may come from the vaccines, I find that very hard to make a compelling argument for a government mandate. In the United States, my understanding is that they have passed legislation that will allow employers to make the vaccine mandatory for employment, but I haven't seen that yet in Canada.
Thank you, Grace and Jay. Next one, I think, is for Dr. Cho. Is there a test for natural immunity for those who have not had the vaccine shot?
Right. So all immunity is really natural. But I would recommend people, if you haven't had your annual blood test, to get that test done. There is no real test to say like, your immune system is operating at like 90% capacity and yours and the other person like 50% capacity. So there's no real test to actually ascertain that. But on an annual physical, it can ascertain, whether you have diabetes, whether you have whether your kidney is working properly, whether your liver is working properly. So if you rule out chronic diseases, then generally you can assume that your immune system is probably working quite well. When you do your annual physical blood test, there's something called the CBC, complete blood count, and that tests, all your white blood cells, or a lot of your white blood cells, and so that could potentially be a marker, but really there's no test to say like, what your immune system is really working well or not. It's really, you have to rule out any health conditions, and then that gives you kind of a sense of how healthy your body really is.
Okay. Thank you, Dr. Cho. Next question from Mayor. This is for Jay and Grace. Can a company insist on receiving the results from a third company's employees that is working on the job site?
Ask that question again, sorry.
So if I'm understanding it correctly, it's like, can a company insist on receiving the results from another company's employees who are working on the job site? Like a general contractor, for instance.
Yeah, I think the answer to that question, without some additional legislation, is no, because of privacy rights. So you have there is privacy legislation in provinces that deal both with records and communications to the government, and then also records in the private sector. And so in Alberta, for example, the legislation is with respect to private entities is called PIPA, the Personal Protection Information Privacy Act, and so private entities have to safeguard that information. Now, if there was some explicit provision in a legislative statute that required the release of that information, I'm not aware of it.
Thank you, Jay. Next question, I think it's also for Jay and Grace. I'm wondering, as a healthcare worker at a long-term care facility, what my rights are if I choose not to get the vaccine? They are a healthcare worker at a long-term care facility.
May I speak to that?
Yeah, sure.
We have long-term healthcare facilities in the Adventist Church, and they have to get consents in order to give the vaccine. You also have to have, there are conditions for giving the vaccine. You have to have life-saving equipment because the Moderna and the mRNA contains polyethylene glucose, which that's the reason that people are having the anaphylaxis. So like they code and they bring them back. And so you have to have that kind of machinery available. And in that, so there is a long-term care facility in Alberta, which I know that the government has said, if you have an employee who does not consent to getting the vaccine, they are still allowed to work and be around the residents. And that is just a very narrow, it's a very narrow bit of information that I'm giving you just with respect to one province and one long-term care facility. So I don't know what's happening across the province because I'd have to have that information, and we just don't have long-term care facilities in every province.
Okay, thank you, Grace. Next question for Dr. Cho. Why do you give a vaccine to frontline workers first when we don't know the side effects yet?
Well, I think, okay, so first of all, in the Pfizer and Moderna studies, they did look at side effects, all right? So the studies document side effects to the vaccines, pain at injection site, fever, muscle pain, use of fever medication, that type of thing. So there are known side effects that have been documented within 7 days of getting the vaccine, okay, of dose number 1 and dose number 2. Okay, so it's important to point out that they have documented side effects. Okay, in terms of adverse reactions, they know they have a reasonable sense of adverse reactions up to 2 months after the second dose, but not beyond that. Okay. Now, the reason why they're given to frontline workers is because they're frontline workers. So, so I think it's pretty obvious why they're giving it to those people. But I just want to point out that they do know to some degree the side effects of these vaccines. In terms of long-term effects, they don't know. But okay, immediate side effects, they do know.
Okay. And just to follow up with that, there's another question. Should someone with an autoimmune disease take the vaccine, such as lupus?
That's a great question. And right now, lupus and autoimmune disease are not a contraindication for getting the vaccine. Okay, people with history of allergies, for them it's recommended that they don't get the vaccines. But lupus and other autoimmune diseases are not a contraindication. Okay. Having said that, though, we do know that vaccines work optimally when the immune system is working optimally. And so, if people are if people with autoimmune disease are on immunosuppressive medications, then I guess it's to be determined how that's going to impact the efficacy of the vaccine, right? But really, that's a conversation you should have with your healthcare provider. But a disease like lupus and autoimmune disease are not contraindicated for the COVID vaccine. Okay.
Okay, thank you. A question for Jay. So Jay, there's I think we have an American friend who's joined us and is saying that down there, the president-elect has said that he's going to mandate vaccines and masks, and this will affect travel, and only those who have a vaccine apparently can't get the travel pass. So if it's mandated there, how will that affect travel to and from the United States to Canada? Maybe we could even just generalize if other countries are doing this, how will that affect Canadians? So any thoughts on that?
It remains to be seen. There's a lot of talk about what's going to happen. I know that Spain has talked about having a registry for people who are not vaccinated, they refuse the vaccine. And so, you know, obviously you're on the government's no good list if you do that. And obviously there would be implications. We don't know what they are yet. I hesitate to speculate. It remains to be seen what actually is going to transpire. Things have to go through Congress, and then they'd be subject to judicial scrutiny in courts of law. So it remains to be seen. But of course, the rumblings have started, and you know, it's very concerning.
Thank you, Jay. Grace, here's a question directly for you from Royce. Thank you, Royce, for joining us. Has the Adventist Church in Canada considered any action against governments regarding religious rights or civil liberties of churches and its employees being violated? Grace?
Ask the question again, sorry.
Yeah, the question is, has the Seventh-day Adventist Church in Canada considered any action against the government regarding religious rights or civil liberties of churches and its employees being violated? So will the church ever step in?
Yes, the church will step in. They have not stepped in because the information that we've had is in the past has been that the government has imposed the restrictions on similar industries, or not industries, but similar situations. So like we had understood, for example, that bars were not allowed to be open. But when you have a government that is opening bars because they have a kitchen, and so they're food, and so that it's essential, but you're not allowing a church to be open, they will, they would consider that to be a religious liberty issue. And it's just a fine line that I think has been thrown down, but that to me is direct discrimination against churches. And I do understand that is the case in one of our provinces. We just got this information, so it's being looked into, and we would work. We wouldn't. It wouldn't be me because I'm not an expert. We would definitely retain outside counsel, but it's something that's just being understood and looked into, and I don't even know if the report was accurate.
Okay, thank you, Grace. And we are almost at time here. So last question for you, Jay. It's regarding states of emergency. So does a state of emergency change our constitutional rights? Example given is entering a home without court order or search warrant.
No, the answer is no. In most circumstances, the charter is still present, and the government has to justify these measures and these laws. And so there's obviously, one of the issues is that you have a lot of protections for civil liberties in a criminal code context. For example, if you have an incident with the police where you're detained or you're arrested, where you're incarcerated, there are all these checks and balances that exist regarding your liberty. You have to be provided with reasons for your arrest. There's a limited amount of time that you can be detained for without, detained or arrested without a right to counsel. You have to be able to have a bail hearing. The Crown has to show cause why you should be detained, and the presumption is liberty. But in the case law, there's very, very little law regarding the health context. And so you have people, for example, in Quebec who are being arrested by the order of a health official. The police just do what the health official says. They go to a secret isolation facility. There's no bail hearing. There's no lawyer. There's no judge. So it's all very, very concerning. And so this kind of stuff has to get in front of a court quickly and parameters established, right? There has to be lines. It cannot be well, whatever the government says, because it's an emergency, the government says it's an emergency, therefore I can do whatever it wants. That cannot be the law, because that is not a law. There is no law in that circumstance. And so, like I said, the courts were shut down for a long period of time. They're backlogged, and but some of this stuff is trickling into the courts now, and we're going to have decisions, and that is, it is certainly going to provide some direction both to the citizens and to the government as to what the parameters of what they can and cannot do are. And that's, we're way past time that needs to happen, but it's happening now.
Okay, thank you so much, Jay. So we are at 8 o'clock, so we're gonna wrap this up here. So first I wanna thank Dr. Cho, Jay Cameron, and Grace for sharing your expertise and time with us. Thank you so much. I think these are really important issues that are not being discussed as much. And I think we feel that they should be. So we hope that we've shed some light on some important questions. Sorry for those questions that we could not get to. We wanna, again, share with you, we have a session tomorrow at 2 to 3 about the Pfizer and the Moderna vaccine. So if you want to learn more about the actual studies on those vaccines, we encourage you to check it out. You can register at lifestylemed.org/online. I'll keep this slide up. So thank you so much for sharing your Saturday evening with us. And we hope to see you at a future events. And in the meantime, have a good night. Thank you, and may God bless you and keep you healthy. Thank you so much.